Hello, I'm James Archer on behalf of P4D Management, here to do a quick lubrication video walkthrough with you. However, before we get started, I wanted to address a few things more that were mentioned in the videos but need to be clarified. First, we do not recommend lubrication machines because they can run dry and it's very common. You won't know until it's too late, until thousands of dollars of damages are done. We recommend the manual lubrication of the handpieces, and we recommend Vector Spray. The Vector Spray is in the P4D formulary. And it's also very important to make sure that you get enough cans that with all the right adapters for the P4D offices. The tips themselves must be threaded on. Do not just push them on and attempt to use it. It'll spray back on you and it will not lubricate the handpiece. These tips are threaded inside and they thread onto the connector caps. That's why you want to leave them on the can and not try and trade cans all the time. It just makes it so much easier.
Do not use lubrication machines. Using lubrication machines on handpieces can have drawbacks. Over-lubrication risk. Some lubrication machines can apply excessive oil, which can lead to residue buildup inside the handpiece. This buildup may affect performance and longevity. Control and precision. Hand lubrication allows for precise application of oil and better inspection of the handpiece condition, ensuring that only the necessary amount is used. Using cavicide or disinfectant wipes to clean dental handpieces is not recommended. Surface damage. Many disinfectant wipes contain harsh chemicals that can degrade the external casing of handpieces, leading to cracks, discoloration, and weakened materials over time. Internal contamination risk. Wiping the outside does not clean the internal components. Handpieces must be properly flushed, cleaned, and lubricated to remove internal debris and prevent buildup. Vector lubrication spray ensures optimal handpiece performance and longevity. Use only the recommended Vector spray. Vector multiple adapters. The right adapter makes lubrication fast, accurate, and easy. We have many to choose from for your specific need. 4-hole standard adapter. Star type adapter. NSK type adapter. K-style adapter. Universal type adapter. E-type adapter. Attic/W and H adapter. The right adapter makes lubrication fast, accurate, and easy. We recommend the DCI handpiece flush system.
Hello, we're here today to talk about handpiece lubrication and how to do it correctly. You're going to need a few things before we start. One of them is isopropyl alcohol, preferably 90%, and a quality lubricant like Vector Spray. This is what we recommend. Now, this is not the only lubricant out there, but it is the best one for autoclaving handpieces. It also has a very handy chart on the back which tells you how to match up the different types of adapters to the different types of handpieces so you can always do this correctly and get the right one. We highly recommend Vector Spray, but if you don't have Vector Spray, you can use Keva Spray. There's very few others that I would recommend, but they are basically the same oil. Now, one of the things that you absolutely do not want to have on any handpiece surface is any type of disinfectant. Now, there are a few now that are handpiece safe, and they say that, but there are very few. So do not use a cavicide wipe or anything like that onto a handpiece that can be corrosive, especially Cavicide 1 or other products like that that have a tendency to rust the handpieces and eat holes in the handpieces. So make sure that you do not use disinfectant wipes and only use alcohol wipes where needed. Let's talk about lubricating electric handpieces. Now, electric handpieces can be identified as the ones that fit generally on electric motors. They are E-type handpieces. You use a very specific nozzle. It is very important that you use the E-type nozzle correctly. They have to fit onto the nozzle and have a tight fit as it's spraying forward all the way through the handpiece to clean it out. Any other nozzle would be wrong and will not lubricate the handpiece correctly. So many times I see people using small nozzles like this to try and lubricate the handpiece. It does absolutely nothing. You might as well not even lubricate the handpiece. So it's very, very important to use the correct E-type adapter. So what we're going to do is we're going to place it on the E-type adapter. We're going to put it on our Vector spray can. We're going to go ahead and spray it for 2 seconds. Count of 2, 1, 2. We're going to remove it. The handpiece will have some exterior oil on it. We're going to get a alcohol 2x2 wipe, pure alcohol preferably. And we're going to wipe off the exterior of the handpiece, which is going to remove 99% of the oil off the handpiece. At that point, you can bag it, unbag it, sterilize the handpiece as you normally would, and it's ready to use. Moving along, let's talk about implant and oral surgery handpieces because they do require a little bit different care. So your typical implant electric angle is going to use a same type of E-type adapter, and it's very important again that you use the correct adapter. That should fit all the way up into the handpiece before you spray it for 2 seconds. Count 1, 2. The lubricant's going to run out of the head of the handpiece. At that point, you simply take an alcohol-soaked rag, wipe off the exterior of the handpiece, bag it or unbag it, whichever your office does, sterilize the handpiece, and when it comes out, it's ready to use. On the oral surgery style handpieces, the basic step is the same. You're going to use the correct attachment that slides up all the way in. You spray the handpiece for 2 seconds. Continue if it's not clear. If you see blood or any other dark material coming out of this into a white rag, if it's running out dark for any reason, continue until it's clear because that's probably blood. After that, take the different attachment, which is a pointed nozzle attachment. It's very small, and use this to clean up into the chuck mechanism. So take out any burr, spray this again until it runs clear out of the handpiece. If there's any blood or dark liquid, keep spraying until it's completely clear. Very, very important to make these last. And then use your same alcohol 2x2 or wipe. Remove any excess oil on the outside, bag, sterilize, and you're ready to go. All right, moving along, we're going to show you how to lubricate most low-speed handpieces, including hygiene handpieces. This also starts out with making sure that you have the right connectors for the different types of handpieces that are out there. Most low-speed motors are going to have a similar back end like this one. It's called a 4-hole back end. You want to use the correct adapter that already has the holes pre-drilled in it so you cannot mistake how you lubricate the handpiece. That is the absolute easiest way to line up, spray, and lubricate the handpiece. So with this particular handpiece, we would go ahead and spray it for 2 seconds. Once it's done, we would run this handpiece because it is an air motor and it needs to run up and expel the excess lubricant. Once that's done, and you can take it into the operatory or use an air station to do that, bring it back, wipe off the exterior of the handpiece with a damp alcohol 2x2, only alcohol, nothing else. It will remove 99% of the oil off the handpiece. Then go ahead and autoclave the handpiece as you normally would. When it comes out, it's ready to use. The attachments are a little bit different, so we're going to go over each one. The contra-angle attachments on these handpieces are generally in 2 pieces. So it takes up to 2 different lubrication nozzles to lubricate these correctly. One of them is called an E-type nozzle, which is very common. It fits all the way up into the handpiece like so. You can't miss it. You'll know there's only one like that. And it also takes a pointed nozzle, which we'll get into in a moment. Initially with these, you want to take these apart. If it has the type that has a removable head, it's important to take the head off of the handpiece. There's a small gear shaft inside that also needs to be oiled periodically. So with these, I always start with the small nozzle, the pointed nozzle. Go ahead and spray into the head for about 2 seconds. Spray the gear shaft for 1 second. There's generally a small hole in the gear shaft, and that's where these little pointed nozzles go. Reassemble the head, like so. Take the E-type portion or the contra-angle portion and use your E-type adapter and spray it for 2 seconds. Reassemble. Because these are gear driven, it is not necessary to run these. So these can simply be wiped off with the alcohol 2x2 and they are ready for sterilization. Straight nose cones also generally require 2 different spray nozzles, and I'm going to show you which ones. Again, the E-type nozzle and the pointed nozzle. We'll start out with the E-type nozzle. The E-type nozzle fits on like so. Spray it for 2 seconds. Remove it. Take the pointed nozzle and go into where the burr goes and spray it for 2 seconds. Spray until it runs out clear. If it runs out dirty, or any type of dark oil, continue to spray until it's clear. And that also goes for any model that you see from any type, from electric to air driven. If it's running out black, continue to spray until it's clear. You're getting it completely clean. After that, you simply take the handpiece nose cone, wipe off with an alcohol 2x2 again, and sterilize. You do not have to run these because they are gear driven. Hygiene handpieces come in all types. Some have removable nose cones and some don't. But we're going to assume that they both have it, and we're going to show you how to do each type. So we're going to start out with, if it is the type that comes apart, you want to take the nose cone off separate and have the motor separate, and you're going to lubricate them separately. You cannot lubricate them in one piece. It does not work that way. So most hygiene handpieces, again, have a 4-hole back end is what we call it. There's tubes sticking out that screw down. So you're going to want to get the type of adapter that has the multiple holes in it to line it up so you can only lubricate it one way. Spray it for 2 seconds. Now this is an air motor and it is going to have to be expelled. So run it for 2 seconds. Go ahead and put it down for a moment. Wipe off the exterior of the handpiece with an alcohol 2x2 to remove any exterior oil. Take the nose cone and use an E-type adapter on it. Now that will fit up in there, and you spray it until it runs out clear. You can put that back onto the air motor and go ahead and run the air motor in the operatory or back onto an air station depending on what you have. Once it's done, go ahead and wipe the exterior of the handpiece again with an alcohol 2x2. It'll remove any excess oil, sterilize as needed. Very simple. The procedure for sterilization and lubrication is pretty much the same. The difference is just making sure that you have the right nozzles every time, because that's the biggest error that happens. Okay, moving along, let's talk about high-speed handpiece lubrication. There are many different high speeds on the market, so it's very important to know what type of adapter you require. This is the first and foremost important thing, because using the wrong adapter, you're not getting any oil up into the handpiece. So find out what type of handpiece that you have and make sure you have the right adapter that fits snugly up into that handpiece to lubricate. This particular type of handpiece fits on a Kevo adapter, a very common type of adapter. So I'm going to go ahead and through the process with this one first, and then I'll move on to like a typical 4-hole handpiece and slow speeds next. These type of quick disconnect handpieces are all lubricated basically the same way. Find the right adapter for the handpiece, put the handpiece all the way snug onto it, spray 2 seconds, 1, 2. Remove the handpiece. On the high-speed handpieces, you need to blow out the excess oil. So either take it back to the operatory and run it for approximately 10 seconds, or put it on a quick blowout like a DCI device, which will run the handpiece just enough to blow out the excess oil. After that, take an alcohol 2x2, again, damp but not dripping, wipe the exterior of the handpiece. This will remove 99% of the oil off the handpiece. Bag the handpiece, or don't bag the handpiece depending on how your office proceeds, and after sterilization the handpiece is ready to go. You do not need to re-lubricate with this particular type of oil. There are also this type of high-speed handpiece, which has the tubes coming out the back end with screw down, or screw down type is what we call it. This takes a special adapter that is only for those generally. It has built-in holes so you cannot misline up the handpiece. These are the best type of adapters to use so you cannot lubricate the handpiece incorrectly. You'll follow the same as the initial handpiece with a quick disconnect. Go ahead and spray for 2 seconds. Take the handpiece into the operatory or onto a quick air station. Blow the handpiece out for 10 seconds. Come back in the sterilization room. Wipe the handpiece with an alcohol damp 2x2 to remove 99% of the oil and sterilize the handpiece. When the handpiece comes out, you do not need to relubricate if you're using this oil. You do not want to use any type of other disinfectants or anything else on these handpieces either. And that's it. It's very simple, but you just have to adhere to the same program every time.